In this film, you will learn, step by step, how to empty your bladder. It is relatively simple, but will require some practice. Start by washing your hands thoroughly with water and soap. Remember also to wash your thumbs. Alcohol hand gel can be used if you don't have access to washing facilities. Make sure you have all the equipment you will need before you start.
You will need a catheter, intimate wipes or soap with neutral pH value and water to clean your penis. Pull your trousers and underwear down and stand in front of or next to the toilet. If there is a possibility you may be able to pass urine, always try to before you use a catheter. To prevent pushing bacteria into the urethra and bladder, you must first clean the head of your penis properly. Gently pull the foreskin back and wash the head of the penis. To remove any bacteria that might be present at the opening of the urethra, you should clean your penis starting at the urethra and working outward. Use each wipe only once. Open the catheter, grab the white funnel connector and pull the catheter out of the tubing. You may feel a little resistance when pulling the catheter out of the tubing. The catheter is now ready to use. Make sure that the catheter does not touch anything before you insert it into the urethra. If it does, discard the catheter and use a new catheter. A catheter that has been in contact with the sink or your skin may be contaminated and could potentially cause infection. Hold your penis pointing upwards and towards your stomach. This will ease the insertion of the catheter as the natural S shape of the urethra is changed into a U shape. Provide a gentle pressure to the head of your penis in order to open up the urethra. To help insertion of the catheter, it is important that you relax. Slowly and gently insert the catheter into your urethra. You may feel some resistance when the catheter is passing the prostate and the sphincter, so be gentle. Insert the catheter until it reaches your bladder and the urine starts to flow. Then continue for a few centimeters further. When the flow stops, move a little and straighten yourself up to make sure that the bladder is completely empty. Withdraw the catheter slowly to ensure that you drain any remaining urine at the base of your bladder. Once any additional flow of urine has finished, slowly withdraw the remainder of the catheter. The catheter can then be placed back into the tubing or disposed of directly. With a little force, you push the catheter into the tubing. Now close the lid and the tubing is sealed. You can dispose of your catheter and tubing in your household rubbish. Do not flush it down the toilet. Wash your hands and you have completed the process.
The catheterization procedure must always be carried out under guidance from a healthcare professional. The instructions provided in this film is only intended as follow-up to the advice you have already been given.